Good evening. So thanks so much for everyone being with us this evening. I know everyone's really busy. We're going to try and make good use of our time together. We are scheduled to go from 6 to 7 o'clock for the public forum to hear questions and comments from residents of Mecklenburg County. I know we do have some media with us, and you get to sit tight and hold your questions or comments till after the forum is done. And the panel will hang out and spend some time with you, but we want to make sure that this time is set aside for residents. We're going to start by asking each member of our panel to share with us their name, their role with Mecklenburg County, and their interest in these changes. Just a few housekeeping notes. If you do have cell phones, if you would please silence them at this time. It's kind of like church. Go ahead and turn them off or turn them to vibrate or silent. If you need to step out, you are welcome to step out into the hallway and then join us again. That's totally fine. We just want to make sure that we don't disrupt the forum. There are restrooms in the hallway, and there's refreshments in the back, so help yourself to those. The forum is scheduled from 6 to 7 o'clock, as I mentioned. The format that we're going to use is index cards. So some of you have already gotten those, filled them out. If you have any questions or comments, we ask that you fill out an index card. You guys are overachievers because I've already got a stack right here. County staff is also going to stay with us through the forum. So if you need another one, if you need another two, just give a wave, and I'll show you there's LaShonda and Fallon and Amira's outside, who most of you already met. So as we go through the hour together, if you need some blank cards, or if you're finished writing your question or comment, just give a wave, and the ladies will come to you and then bring them up to me. Just kind of helps because we are taping tonight's forum for broadcast later, and it just helps with the microphones and the cameras. Just another point of information, this is not a public hearing. This is a public forum to get information out and to hear from residents of Mecklenburg County. If you would like to sign up to speak at the September 2nd Board of County Commissioners meeting, we would love for you to do that as well. And there's county staff, the other Rebecca Carter, can help you with that if you'd like to speak at the Board of County Commissioners meeting on September 2nd. So with that, I will start. We will hear from our panel, and then we'll start with our questions.
Thank you, Rebecca. I'm Michelle Lancaster, Assistant County Manager with the Mecklenburg County Manager's Office, and my area of responsibility is Health and Human Services. And I really do appreciate all the interest here. I wasn't sure with the rain today what we would get, so glad to see that you took the time out of your day to come and have this dialogue, which is really what my goal is that we're able to hear any concerns or issues that you have, answer questions, and share and learn with one another about what any of the issues are around the two proposed ordinances. I would also like to take just a point of personal privilege to introduce and allow them to introduce themselves. Three of our board members are here. Vice Chairman Dumont Clark, District 1 Karen Bentley, and at-large Pat Cotham. Both Pat and Karen serve on the board's Health and Human Services Committee, and if either of you would like to say a few words, please do. And then we'll move on down the line with the panel.
Sure, I will keep it very brief. I'm glad you are all here. I think I don't want to speak for my colleagues, but I think I'm safe to say that we are here to hear what you have to say. We have had quite a bit of dialogue on this topic, but we are very eager to get your feedback. And as Rebecca said, you will have another opportunity at the first board meeting in September. So the more input you can provide us, the more informed our decision will be. So I'm glad you're here.
Pat Dumont.
Oh, no, I'm here to listen.
Okay.
I would also just join Mr. Bentley that it's that I wanted to be here and to hear from our health department and our Parks and Rec department, and to see what's on your mind. And this is a big decision for us, and we're trying to do our due diligence to get the information so we can make those decisions. So thank you again for coming, and then we can, some of you, if you want to talk after the meeting, we can do that. Thank you.
Well, hi, everybody. I'm Dr. Marcus Plescia. I am the director of Mecklenburg County Health Department. I'm also a family physician. I worked in Mecklenburg County for about 8 years early in my career as a family doctor. So I'd like to just give a little bit of background as to why we've gone this course in the health department, why we have put this forward to the board and why we really feel like it's something that we have a responsibility to pursue. At the end of 2013, the county completed a community health assessment where we engaged the public in trying to understand what people think are the most pressing problems for Mecklenburg County. We did this with a large 600-person survey to get responses that way, and then we convened about 150 people, leaders from human service agencies across the community and also the general public, and we brought those folks together for a couple of days to brainstorm and talk through what the main issues were. The number one issue that came through both of those formats that we used is chronic disease. Chronic diseases are things like heart disease, cancer, diabetes, emphysema, arthritis. Those are all chronic diseases. This is an appropriate thing to be the first policy. These conditions are the conditions that really do cause the greatest amount of death and also of suffering in Mecklenburg County. So when I first came to Mecklenburg County at the beginning of 2014, we sat down at the health department and talked a little bit about what do we need to do to really take this on and to try to make a difference, since this is what the public wants to see us succeed with. And the issue that came to the top was the issue of tobacco control. What can we do to lower the rates of tobacco use across the county? The rates for adults using tobacco products in Mecklenburg County are 20%. 20% of the population is currently using tobacco products. The national goal to reach by the year 2020 is to get that down to about 10%. That's an ambitious goal, but I think it's a realistic goal. It's a realistic goal because particularly when it comes to tobacco use, we have very good evidence-based tools that do make a difference and do lower tobacco use rates. And tobacco restrictions, which is what the ordinance that's been introduced is, and the ordinance is, the specifics of the ordinance are on the board up there, just so there's clarity about what exactly is being considered. Tobacco restrictions are very effective in reducing use of tobacco products across the community. And they work for three reasons. They work because tobacco restrictions help people who are smokers or tobacco users quit. That's something we've seen across the nation. Tobacco use restrictions help keep young people from starting to smoke. And this is probably the most compelling part of this particular strategy. 90% of adults who smoke started smoking before they were the age of 18. So if you really want to make a difference in tobacco use, you've got to look at ways to keep kids from taking up the habit in the first place. It is very, very difficult to quit smoking once you've started. As I said, I've been a primary care physician for 20 years. I've tried to help a lot of people quit smoking. 60% of smokers have made a quit attempt in the last year. Most people who smoke want to quit. Given how difficult that it is, the most effective thing is to try to keep people from taking it up in the first place. The final reason why these restrictions are important and effective is the issue of secondhand smoke. Obviously, if you restrict use of tobacco products, and particularly cigarette products, there's less exposure by non-smokers to tobacco smoke. And we know now without question that exposure to tobacco smoke, if you're a non-smoker, is very harmful to your health. In fact, as many of you know, North Carolina passed a smoking law banning smoking in restaurants and bars in 2010. After that law passed, we saw a 17% decrease in emergency room visits for heart attack symptoms. This is something we've seen in other communities. We've even seen it in other communities where they've passed this kind of a law and then they've gone back and rescinded it, and the rates of admissions to emergency rooms for the heart symptoms have gone right back up to where they were. So there is a real benefit, there is an immediate benefit around exposure to secondhand smoke for people who have risk factors for heart disease. So those are the core reasons. This is evidence-based. We know that doing these kinds of things is effective, and that's why we felt it was an important thing to put forward for the Board of County Commissioners to consider. Thank you.
Good evening, everyone. My name is Michael Kirschman, and I am the Deputy Director for Mecklenburg County Park and Recreation. Our stance is that in our award-winning Park and Rec Department, we are here to provide recreational opportunities to the public. And we want to provide what people want, like any good government department. We're here to serve the public. And so our goal is to provide the types of amenities, the types of recreational facilities, and the types of experiences that the public wants. And according to our research, the public want tobacco-free parks. And that's according to the survey that we did in 2013. So that's kind of our history and what we're trying to provide. Thank you.
Hi, my name is Kim Bea, and I'm a health educator at the Health Department in the role of Tobacco Prevention Coordinator. And I've been doing tobacco prevention and cessation work for about 15 years now, and have a special interest in youth prevention. As mentioned, 90% of adult users started before the age of 18, and so we really have got to do something to change that, to get kids from not to start. And another thing that I just wanted to mention, in health education, there's a real basic premise, and that is education alone does not equal change in behavior. If that were so, then, I mean, we all know that smoking is bad for your health. But education alone does not work. It's very important. It has to be a combination of policy, education, mass media, and it's that combination of things that we're trying to do here to truly make a difference. And so I welcome the opportunity for the dialogue tonight.
All right, and so it's about 6:15, and I already have a hefty stack in front of me, so we'll get started. I will add that the panel will take turns and toss the question to whomever they need to. If you want to specifically ask one specific member of the panel a question, you can also indicate that on your card. Also, all of these questions will eventually end up on the county's website. We're going to do a FAQ section so that, you know, if you have to step out or what have you, that will be on our website as well. All right, so let's get started. All right, if approved, how would this ban be enforced? With dwindling budgets, will this require the expense of hiring additional tobacco hunters?
So I'll answer that. So, you know, we have a lot of experience with these kinds of bans and restrictions because we are not the first community to do this. These kinds of things have been occurring all over the country. And what we have learned from that is that this is enforced through what actually our police chief described to us as social enforcement. If you make it very clear to people what the rules are, and you do that with signage, if you make it clear where you can smoke and where you can't smoke, people will follow those rules. And again, this is not me saying that's the case. This is based on looking at what's happened in other communities. So, you know, the idea that we're going to have tobacco hunters out there, we're not going to have that. We are going to have to spend some resources on making some signs so that it's very clear for people what the rules are, but that we anticipate will be the only expense. That's our plan.
That's great. This is a two-parter. First, are e-cigarettes included in this ban? And in parentheses, you know, no secondary smoke, please explain. The second part, what about designated smoking areas in larger parks?
Take the first one, I'll take the second one.
Yeah, I mean, e-cigarettes are, so the North Carolina legislature has defined electronic cigarettes as a tobacco product. So based on that, the first ordinance, which is about smoke-free grounds, would mean that e-cigarettes would be okay to use on the grounds. The second part of the ordinance, which makes parks tobacco-free, means that in parks, e-cigarettes would be considered a form of tobacco product and they would not be allowed. So that's an answer to that. I do want to just say one thing about the second part of the question. You know, it is very important to me that we do evidence-based, scientifically valid things around public health in this county. And, you know, tobacco ordinances, tobacco restrictions work if they're clean and they don't have loopholes and exceptions like special smoking areas. I think that would totally undermine the purpose of the ordinance and the restrictions. So we will not have special areas for people to go. If people need to use tobacco products or smoke, they'll have to go off of the campus to do so.
I will just follow it up with certainly one of the reasons, and Dr. Plescia talked about this earlier, was the role modeling. And if you were to permit smoking areas in parks, it would not address the role modeling behavior at all. Additionally, that would create a level of coordination, signage, enforcement. It could get very confusing very fast on where you put these areas. And again, it wouldn't do anything in terms of the outcomes we're looking for, but it would create quite a complex situation to handle if done.
All right, another two-parter. Explain Health Rule Section 4, Number 3, quote, tradition golf course, unquote. Is this a municipal course? If not, why is it mentioned? And the second, expand and give an example of Health Rule Number 15 under Section 2, definitions. So do we have it in front of us?
I can talk about the tradition.
Okay.
The tradition golf course, the property is owned by Mecklenburg County, but the golf course was actually built by a private developer, and so our lease arrangement for that operation is completely different than our other municipal golf courses. So that's why you see them noted as separate and excluded from the agreement. It's actually just, it's a legal issue with our lawyer, and so that's why that golf course would not be included. What was the second question, Rebecca?
I just handed it to Kim.
Okay.
Okay.
I can read it.
Is that referring to government grounds or tobacco-free parks? There's not a number 15 in, so it must be.
I'm going to share it with you guys, and we can come back to that one.
Section 2 definition.
I don't see a 15.
Okay. And if we have time at the end, we can kind of open it up as well.
Yes,
Oh,
absolutely.
actually, there, page 4.
Oh, I see, yep.
Page 4, there is a 15.
Okay.
Public place. This ordinance does not affect public places. The definition is in there, but this does not impact public places.
A public place would be any place that the public is invited to come in. So that is one of the areas that the North Carolina General Assembly now allows local communities to have tobacco restrictions. We have made the decision to not exercise that potential authority, so that's not relevant to the two ordinances that are on the board.
Well, and that kind of ties with the next one. Does this impact private golf courses or parks or CMS ball fields?
This does not affect private golf courses or a private park, if there are private parks. Now, CMS, the school system is already 100% tobacco-free. So this, I mean, this doesn't affect them. They already have a rule in place that you cannot smoke anywhere on the grounds of a public school. So, and that would apply to ball fields as well.
What has prompted this proposed restriction? Is it due to improper disposal of tobacco products, wrappers, cigar butts, cigarette butts, etc.?
I mentioned at the beginning with the reasons.
Yeah, I think I hit on that. I mean, our impetus to go forward with this was about health, and it was, you know, our mission is to protect the public's health, and there are a number of reasons why we think this would make a pretty significant difference in that. There are other issues about these kinds of tobacco restrictions, particularly in the parks, and I can let you speak to those, litter and fire.
Sure, we certainly do get litter from tobacco use, but that is not the primary driver or the reason for the ordinance. It is a health issue. The primary reason is that.
And
But
there
it would
are,
impact less cigarette butts and less trash that our staff do pick up, that's for certain.
and there are a number of communities, we're probably not as good of an example, but there are a number of communities, particularly in the West, where it's made a big difference around fire control as well.
All right, we said we'd take questions and comments. I have a comment, and so then you all are invited to comment on the comment. I strongly support the ban. I am an avid golfer and play at least once a week at the Ratcliffe Golf managed by county courses. I support the ban for health reasons for myself and for others. Plus, the stench of cigar smoke is very irritating, and the littering of cigar and cigarette butts on the courses is not proper. That's a comment. All right. And just a reminder, if you have any cards that you want to me to read, Fallon is over there and Amir is right there. So we've got some cards and the ladies will bring them up to me. All right, next one. In the proposed regulation, it states, quote, "The assertion that e-cigarettes are harmless and help people quit smoking is not based on valid evidence," unquote. Can you state any cross-sectional, longitudinal, peer-reviewed studies backing up this claim? Numerous studies show e-cigarettes as effective cessation devices. Please comment. Thank you.
We feel that the word is still out on electronic cigarettes, and that's why you see there's a two-part ordinance where we're only doing smoke-free grounds, and then it's only in the parks that we expanded that to tobacco products. It's not clear what the potential health effects of e-cigarettes might be. The Food and Drug Administration, the FDA, is currently looking at that issue, and we hope that when they finally make a ruling, that'll provide some clarity around whether there is a danger in using electronic cigarettes. You know, the assertion that electronic cigarettes are sort of an effective cessation method, I would urge caution about. There are very, very good nicotine replacement therapies available now for individuals. And there are even nicotine replacement therapies that are inhaled therapies where you can inhale the product and it helps people counter some of the cravings that they have if they're addicted to nicotine and they aren't able to use nicotine products. But electronic cigarettes are not considered to be a nicotine replacement therapy. They are a product that's, you know, being marketed for a variety of different reasons. And we do have concerns about them being used in that way because there's an extraordinary amount more nicotine in most electronic cigarettes, and the process by which the nicotine is vaporized is a process we don't understand very well. So we're really just not taking a stand to say that they're good or bad. We feel like the verdict is out on that. I do want to caution people, though, that if they're looking for a way to cut back on tobacco use or nicotine use or quit smoking, I would really strongly encourage people to use nicotine replacement therapy where you kind of know what you're getting as opposed to using electronic cigarettes.
Could I add, there are a couple handouts at the health department table about electronic cigarettes that are factual based, and so I encourage you to pick up those handouts if you'd like some more information. And another thing to note, a real concern with electronic cigarettes is that they are very attractive to youth. They come now in a lot of different candy, bubble gum, caramel, all sorts of candy, fruity flavors, and that's a real concern because, and the statistics show that the use among youth has doubled and tripled since they have come out. And so there's a real concern that this is going to hook our kids before we even know all the information. And so there's real caution about electronic cigarettes.
Michael, this one's for you.
Okay.
To the representative from Park and Rec, what did you mean when you said role modeling? What are you talking about?
So with role modeling, what we're talking about is what children see. And as Dr. Plescia alluded to earlier, a lot of people, I forget the exact number you used, 90% of people start smoking before 18. And what we want to do is have children not see it as often, to have positive role models in the parks. We believe that if people see it less, they will try to do it less or not think it's as cool. And I don't know if, I know you talked about research that earlier, that is the case. And so if you go to the parks and you see people smoke, you'll probably grow up thinking smoking's okay or smoking's cool and I can smoke. If you go to the parks a lot and you don't see any cigarette smoking, it enters your mind less often. So that's what we mean by positive role modeling.
Got another comment. We need to focus on something else. I'm from Chicago and am willing to focus on property tax, which can affect teachers' pay. As I see it here, as I sit here, I was thinking, why is this not an open discussion? Why do we have to write down our cards? I want more to say. So, and I can talk a little bit about the format. We will have time at the end to open up to the floor. One of the reasons we're doing this format is for the cameras because this is going to be broadcast on our website, but I'll also ask you guys to weigh in.
Yes, we will allow open forum after Rebecca goes through the cards. We wanted everybody who had questions to get those out. This is a more controlled format at the beginning, and then it'll be much more informal in just a few minutes. I don't think you
Yep.
have that many more cards.
Nope, I've got
We'll
5,
be-
so.
You'll get your opportunity.
Yep. All right, next one up is snuff and dip are legal and don't cause secondhand smoke. Why are they part of this ban?
Well, so snuff and dip are tobacco products, and if both of these pieces of the ordinance were to pass, they would be banned in parks. And this really goes back to the first two parts of the reasoning behind this approach that I mentioned to begin with. One is that, snuff and dip are just as addictive as cigarettes are. So many people have addictions to these products, and one of the things that we see when we put these restrictions in place is it helps people have that motivation to quit. And most people are motivated to quit, and this pushes them that little bit more. And we do see that when these kinds of things are put in place, it helps people quit. So that's reason number one. Reason number two is this issue that Ms. Baya just brought up about role modeling and what we want these children and kids who start smoking. 90% of adults start smoking when they're kids. We want to turn that around. Tobacco products, whether it's cigarettes or snuff or dip or electronic cigarettes, I mean, they are being marketed to kids now. And we have a basket over there you can have a look at. I mean, it is sort of amazing the number of grape flavored, and there's kind of wrapped up to look like a chocolate bar, or we also many of you remember, we've seen them marketed as being sophisticated, sexy, cool. So, these are things that are out there kind of trying to appeal to kids, trying to appeal to people to use them. The purpose of bans, and that's why, I mean, we don't want people to smoke cigarettes, we don't want people to use, we don't want kids to use dip or snuff either. And the intent is to make it clear that they're not cool, they're not sophisticated, they're not particularly sexy. And so that's the reason for including that in the parks.
All right, so we have a question and then a couple comments afterwards. So why has this restriction taken the government so long? What are the problems or issues for not passing this law? Then there's also some supporting comments. Whenever I have to go to the courthouse, for the last 4 years, it's been very hard to go to the courthouse and not be exposed to secondhand smoke by either government employees or staff. As a mother, I also have concern for my children when we are on the soccer field and have people smoking around us, such as at Freedom Park.
So I think I spoke to this a little bit in my initial comments, but one of the issues that we faced in all localities in North Carolina up until 2010 is that the state legislature had a law in place that basically forbade any local communities from having any kind of laws or rules or regulations that were stricter than what the state said is a bar. So we really were not in a position to pass any of these kind of ordinances unless the state chose to pass them. And all of that changed when the state did the ban on smoking in restaurants and bars. And so we saw statewide the restaurant and bar ban, but then, as I mentioned, they opened the door and said, we're not going to rule on some of these other issues, but we will let local communities decide that for themselves. And this is one of the areas where we now have that ability.
All right, has the County Board of Commissioners indicated their support for these proposed regulations, either as individuals or collectively?
I'll answer that in terms of what the action that the committee took, which the day that the committee voted, I think had 3 members present, Commissioner Leek, along with Commissioner Dunlap, Commissioner Bentley, and Commissioner Cotham. And they unanimously supported this going for the board for a vote on a public hearing. And so what the board did is vote on having a public hearing. So they have not individually nor as a group taken a vote on whether or not either of these ordinances will pass. And just a reminder that the public hearing will be September 2nd, and then the vote on the potential ordinances would take place on September 17th.
Okay. I strongly support tobacco ban in parks in Mecklenburg County. I run on Little Sugar Creek and I'm an ex-smoker. It's very difficult to run by, I I think it's CMC, due to the smokers present. I also strongly support the ban on e-cigarettes in parks and greenways. I quit using the patch and have been smoke-free for 6.5 years. So supportive comment. And this is my last formal question, so if you have others, bring them on up. This is about e-cigarettes as well. So are e-cigarettes considered a tobacco product under this change, and why? And I think we've kind of covered that. So any other index cards out there? Okay, so we will open it up, and this is how we'll do it to make sure we're being fair and we're hearing everyone. If you've got a question, kind of like in school, we'll ask you, I'll acknowledge you, stand up, ask your question of the panel, or if there's someone specific on the panel. If you have a follow-up, that's fine too. We'll try and limit it to one follow-up question per person. That way we can get to other folks as well. So with that, does anyone have a question they would like to ask the panel? Yes, sir. You want to stand up and yeah.
I'm younger. I come from the younger generation that obviously you could smoke. I'm a non-smoker myself. I've had many friends that quit using e-cigs. I've never had one friend that said, I stopped smoking because I had to walk 10 feet to go smoke on the other side of the street. When you were asked about the science behind that statement, you gave a long meandering kind of comment that said, no, there really isn't any science to know either way. Why wouldn't you just wait until the FDA comes out with their science, peer-reviewed, cross-sectional? We know that it's factual-based, it's not biased. Why wouldn't you wait for that to come out when we have this opportunity for smokers to quit with e-cigs?
Thank you so much for your question.
So now the science on smoking bans and restrictions is very clear. When you do bans and restrictions, the rates of use of cigarettes goes down. I suspect that would apply to e-cigarettes as well. The issue that I thought the question was about was more about what are the health effects of e-cigarette use, and we don't have as much information about that. There are many other tobacco products that we think are very harmful, and the state has happened to define e-cigarettes as a tobacco product as well. So it is a two-part ordinance. I think partly that was an interest of the committee that put this forward to not go too far. So one part of it is just going to be cigarettes. The other part is going to be tobacco products. And then e-cigarettes falls into that because it's a tobacco product.
I just clarified I wrote the question, and the question was because you had kind of stated before I was looking up on this issue about how you want to use science, evidence-based things to make decisions. So that's why I wanted to have sources for science and evidence-based. That was cross-sectional, that was longitudinal, that wasn't just kind of like a very small sample size that was studied. And so that's why I was asking that, because if you're using science and evidence-based, then you need to have sources, and there needs to be real reasons why you're making this decision.
So all of the evidence around tobacco bans smoking and tobacco bans comes from the community guide, which is a process which is similar to the Guide to Preventive Services Task Force, which many people have heard about. They give recommendations about screening for cancer and various other things. This is a parallel process that looks at community-based interventions. And so it looks at all of the data, it looks at all of the cross-sectional surveys, and it convenes experts to look at those data and decide whether they think the data is sufficient to make a recommendation. So it is a very strong process and a relatively objective process. Whenever you have human interpretation, there's some subjectivity, but this is an objective process. I mean, some people say just because the community guide doesn't endorse it doesn't mean it's not science-based, and that's probably true, but we went with the strictest source, and that source rules that tobacco products, restrictions on tobacco products works. And we can certainly provide that reference if you're interested.
For e-cigarettes, though? I mean, I'm asking specifically at narrow e-cigarettes.
Yes, and the science is not as clear for e-cigarettes. You're correct about that.
Thank you. And there was a hand in this section. Yes, sir.
How you doing? My name is William Shore, and yes, I'm the one from Chicago. So, quite a few questions here. One, how much is all of this, the panels and the signage costing us? That's one.
The signage for the entire county, which would be all of the parks, all of the greenways, and all of the municipal buildings, will cost somewhere between $100,000 and $200,000.
Okay, we're looking at $100,000 to $200,000. All right. So, next part. Can we find something else better I mean, I support this. I'm not gonna lie, I do. I'm a smoker. I didn't start smoking until later in life, after working for the city of Chicago. And I look at it like, okay, well, actually, it starts from home. Because your role model, or what did you pretty much, let me get this clear, the type or the mental visual stamp print, that's where it pretty much refers to, of a younger individual actually seeing this, smoking all the time, that may or may not make them want to smoke, like me. I watched my grandfather die of emphysema when I was 16. So I never wanted to smoke until I got to a difficult job. So I understand what you guys are trying to do. I commend it. Honestly, I do. But I'm going to hit you with this side too. I feel, and this is how I feel, and this is solely me, that the taxpayers' money is probably being put in the right place. No problem. No problems there. But there's a bigger issue here, and that's why I wrote about the property tax and everything else. I know this is off topic, but I'm figuring this is an open forum. So, I fell in love with the city when I came here. I really did, and that's what prompted me to move here. But the other side of this is, I'm here to help you guys build the infrastructure, where it be roads and everything else. Recreation parks, like back home, we have a park district. There's actually a park district that when the kids let out in the summertime, they have events and reading and everything else they can go to, and teachers teach you this. And this is a part of the Parks and Recreation that I would like to see implemented here. But it's going to take more than just us just sitting here debating. And I truly get it. I get the imprint and everything else. But I look at it like, okay, we need to really focus on other issues. I mean, I'm not trying to, I'm backwards, so you guys got to forgive me. I'm a truck driver, and I was trying to do something else, but what I'm trying to get everybody to really understand here is that our children, yes, are our future. It starts from home. So we want to, like the younger man right here, I think being around the same age, these products that have always been marketed towards younger children have been out here for at least 20, 30 years that I can remember, even back home, I can remember that. But I really want to know and see how this actually will play out and work. That's why I love it. And I was kind of taken back by it really not being an open forum of discussion at first, but I do commend you guys for like opening up. I know I didn't prepare anything, anything like that, but I figured this is open discussion towards the public. I really want to help the county, the city, and everybody else. But there's more to it, so just let me stop.
Thank you, William. Thanks. Who would
Well,
like to-
I think you raised some really important issues, and I appreciate you mentioning them. I mean, you know, the question is, how do we prioritize what are the most important things to work on, what are the most important things to spend our policymakers' times on, and how do we prioritize how we spend money? I mean, you know, the thing about tobacco use is not only does it have an enormous burden in human suffering, it also is expensive for our community. You know, we have a goal to take tobacco use from 20% in Mecklenburg County to 10%. If we do that, if we get to 10%, we've estimated that we can save 650 lives a year. That's a lot of people. That makes this a pretty compelling issue to me. We've also estimated that we can save the county $350 million a year in medical costs and lost productivity. So, you know, this is compelling.
That's for the employee side though as well, right? That's for the employees.
You're saving the county. I mean, this is saving the county because a lot of these restrictions are specific to county employees because the whole restriction on grounds is going to be for the grounds of government buildings.
But once again, my main focus would be more as educating children at a younger age. This is something you don't want to do. And you probably could start in the school system and drill it in like, okay, just because mom and dad does it, doesn't mean it's really healthy for you because they're going to be everlasting effects. And this is what I'm thinking.
Yeah, and I think that's very important. I mean, as Ms. Bea said earlier on, there is a comprehensive approach to trying to reduce tobacco use, and some of it is education, but, you know, we have not had a lot of success when we were just doing education, and once we started seeing the impact of some of these policy-based things, that's when we really started combining all of that. Education, campaigns, and policy changes. That's sort of the three things that bring about the kind of changes we've seen in the communities that have been most aggressive on these kind of things.
Next, yes, ma'am.
Well, first of all, thank you very much. That was my question, what took government so long? I work for health department. I'm also a physician, a mother of two. I came across to see this guy about 10 years ago. And this is the most powerful educational tool that I had in my office since I work for Mecklenburg County. And I think you're absolutely right. It starts at young, because schools cannot have smoking, but in my neighborhood, and I live in Arboretum, half of the high school kids smoke around my neighborhood. And if we don't take it to school level or even to elementary level to teach them what it does and bring people that they've been affected on, banning by itself is only 50%. So thank you so much. And again, the restaurant started for so many long that we're going to lose customers, the bars started, and airlines, but not everybody's happy. Everybody, I mean, I love to go to restaurant with my kids because I don't have to be clustered in one area. So thank you, I'm all for it, and please let us know what we can do as parents, as teachers, as employees to get this going. Thank you so much.
Who's next? What next question do we have? Okay. Oh, yes, sir.
Hey everyone, my name is Plescia. I run a facility for the county. It's called Golf Depot. We're located down on Cadillac Street in Pineville. The question I had was in relation to, smoking with golf and cigars with golf. Golf is viewed as very much obviously a recreation, and there are a lot of fit people that play golf that will run the parks and run the greenways that have been provided for them. But there's also another echelon of golfers that aren't necessarily the fittest members of the public. And the question I had, and I was wondering, has there been consideration made for people who do come to the facility that I have that are smokers that aren't necessarily the fittest people, they're not probably using the greenways, but golf for them is something that keeps them fit. That's the way that they actually get out there and they get moving. They may be smokers and they have this addiction that's hard to get rid of. Has there been consideration made for those people? I know they're only a small portion of the actual community, but at my facility, they're making up more than the numbers, I think, of the broad spectrum that you guys are currently talking about. Has there been any thought at all made for those people and providing them a place where they can come and utilise a medical facility as well?
So are you asking that the golf courses be excluded, or that there be places on the golf courses for folks that still want to smoke? Or what kind of accommodation would you be looking at or requesting or asking for?
I'm not asking for an accommodation. I'm just asking for more so what the science is behind it, just so I can understand it. Because from a perspective of providing a community-based environment, obviously I want to have as many parents and children utilising the facility, and we do get a lot of that at the facility I have managed right now. But we also have a lot of golfers that are in that social demographic that utilise tobacco products. Sure. And it is an area, and it is a sport that is definitely much more socially acceptable and accepted to be utilising tobacco products. Sure.
So we certainly don't want to keep people from playing golf or using our parks or our greenways. That is not the intent of this. I mean, there are a number of ways that people who are, and the other thing I'd like to say is this is not aimed at individual people who smoke. I mean, the idea behind these kinds of restrictions and ordinances is to be tough on the problem and easy on the people. In the case of people who want to play golf who smoke, I mean, some people can play a game of golf without having using tobacco products. Others, it's difficult for them because they have a nicotine addiction. But we do have, as I mentioned earlier, a wide range now of nicotine replacement therapies. I mean, somebody could put a nicotine replacement patch on and they could easily get through several hours of playing golf without feeling that urge and craving for the nicotine, which is the addictive part of the tobacco products. So, I mean, we don't want it to be a barrier to people using the parks, and I think that's the most obvious way to get around that.
And your concern would apply to anybody walking the greenways, fishing, sitting at a playground. That population is the same for all, but there would be options available to them.
There's a great demographic. There's a greater amount of that demographic of smokers who go to golf facilities than walking the greenways. Absolutely. But more of my concern was, well, you know, this is a great ban to help, you know, improve the general health of the entire Mecklenburg County residents. However, what about the guys? What about the people who are smoking? You know, are they being subjected to, okay, now you have to stay home and smoke? Or is it a possibility that we can provide a place for them to still enjoy what they do? Now, yet again, I don't think these people who are smoking are the majority of the users on the greenways, but there is a fair amount that come and use the facilities that we have as golf facilities. Sure. So I'm just leaving the question out there. For me, with my facility, it probably won't make that much of a difference to the overall amount of users, but it definitely will create a certain stigma. And I've had a lot of people, I'm not a smoker, but I've had a lot of people mention this to me and say, look, this is, I can't smoke when I come here now, or I won't be coming back. Now, that's not really good promotion of what we're trying to do from, I think, on the whole for the county. I understand the greenways, I understand a lot of how that works. It's supposed to be more of a fitness environment, but with golf, I don't quite understand. I think there's a lot of stigma from what I've heard, and I think there will be definitely a reduced amount of participation at my facility that I'm managing for you guys with this ban. I'm just voicing the opinion of what I've heard from the customers and from the people that we have visiting our facility.
The question was asked earlier as well, if there was a consideration for smoking areas in all the parks or golf courses anywhere. And really, that would not serve the purpose that's intended for the ordinance. So the ordinance would be that there would be no tobacco use on parklands due to the rule modeling and due to the health impacts. Because we do want those people to try to quit or use less and not use in front of youth, which can happen anywhere if it continues as is.
Yeah, carving out specific places for people to smoke or use tobacco products with these kinds of restrictions completely undermines the restrictions, and you know the whole evidence base we've talked about is sort of lost from that. So, you know, frankly, I think that if we want to have an ordinance where people are banned from smoking in these specific places, then we should vote for that. But if we're going to start having these restrictions and things, I would say we might as well just not do it.
We probably have time for about 2 more. Yes, sir.
Thank you for taking my question. I'm neither for or against the proposed regulation, but I think that anytime you attempt to implement a strategy like this, it's important not only understand your perspective, but that of your opposition. What is the other side saying with regard to this proposed regulation? Is it Big Brother? I mean, what are the concerns of folks who do not want to see this regulation passed?
People are concerned about people who use tobacco products and not wanting them to lose access, as I think your question is a very good one. And you know, and for the government grounds, you know, people who are at work aren't going to be able to go right outside and smoke. They'll have to go off the property. But there are now very good medical treatments and methods to overcome that. People are concerned about enforcement. That question came up, and again, we have very good experience now that enforcement is not a difficult issue for these kinds of ordinances. People are concerned about government overreach that you mentioned. You know, I guess it depends on how you look at it. I feel as a government entity, we have a responsibility to do things like this. I mean, this is a huge burden on our community, and that is one of the roles of government, is to take on these kinds of burdens. So you know, those are 3. I don't know if other people may have other thoughts. Those are some of the main things that we hear. And we hope to, I mean, that is the purpose of this forum, is to sort of understand what people's concerns might be about a regulation like this, and help us think through how to resolve those.
We've heard it that, why can't I smoke or chew if nobody's around? If I'm out in a park or along a trail and there's nobody around, why couldn't I do it then? Well, there's a copy of the ordinances that apply to all the parks over there. We have 47 ordinances specific to our park, and certainly we can't permit people to break into those ordinances just because there's nobody around. So your dog has to be on a leash, whether there's people around you or not, right? And you can't chop down a tree in a park, whether someone sees you do it or not. And so ordinances apply to all the parklands and all the people, regardless of whether you're around other people or not. But that's one of the arguments too. If I'm by myself, why can I smoke? It doesn't impact with anybody. But you can't really make a rule that says you can do something if you're all alone versus, and if you're all alone, 2 minutes later, somebody could walk down the trail towards you and now you're not alone anymore. So there's a lot of concern about that as well from people who are against it. But our research shows clearly that the vast majority of the public are for a tobacco ordinance on parklands.
Yes, ma'am.
To answer your question, when people travel on the airline for either 2 hours or 13 hours, they're 20% smokers, they're still flying, and airline business did not lose their. So it's not that you're going to lose it, it just forces the people to develop healthy habits. And for that reason, don't worry about it.
Yes, ma'am, and you can.
Hi, I'm Dr. Sandra Burke. I am a recent transplant, also from the Chicago area, northern suburbs. In any case, I just moved to, not to Mecklenburg County, but just outside the county.
I need you to move into Mecklenburg. I'm just kidding.
Let's see, I'm also a member of the board of directors of the Greater Charlotte American Heart Association. And certainly I can guarantee you that the American Heart Association strongly supports what is proposed here. I'm also a research scientist. I've done research for the last 30 years, although I'm retired. And one of the things that we haven't addressed here, of course, we know very clearly that smoking is bad for us, but we often don't think of the science, the very basic science. And I was a basic researcher, so I'd just like to share with you things that you already know probably, but they always bear repeating. The importance can't be overstated. The damage that cigarette smoke, both primary to the smoker and secondhand smoke, can do to the blood vessels, the lining, the very delicate lining of the blood vessels. I won't get too scientific, but they're called endothelial cells for those who would like to know. In any case, the damage is significant, and that is just one of many things that can lead to coronary heart disease, can lead to the damage of the blood vessels that feed the brain, therefore have the potential ultimately for stroke, for what is called peripheral artery disease, or PAD, in the legs and extremities, and we could go on and on, even abdominal aneurysm, weakening of the aorta in the abdominal area, which can ultimately bulge out and become, it's an aneurysm. What else can I say? So I just wanted to say that from a personal perspective, I support your ordinances completely, and I know that I speak for the American Heart Association, even though I wasn't asked to speak for them, I'm quite sure that I do. One of the factors, one of the controllable factors in our life simple seven factors that we can, behaviors I should say, that we can control that will lead to better health is not smoking. It's one of life simple seven, as I described. Blood pressure, regulation, exercise, I could go on and on, but I won't do that. I'll simply leave you with the fact that the ordinance is going to make a difference for the entire population, and I do hope that the county commissioners will pass it.
Thank you. So last call for a question. All right, at this time, we're going to ask our panel to share with us any closing thoughts they have, and then Rebecca Carter from Public Information will share just some, again, housekeeping and announcements, follow-up about September 2nd, and so on. But I'll turn it over to the panel at this time.
Well, I would just like to end by thanking all of you for your good questions and comments, and to really point out that this is just a small part of what the Board of County Commissioners considers on a daily and weekly basis. This is a very important piece of public health and what we think is important in the public health sector, but it really is just a chip in the large and vast amount of responsibility that the board has and that we have as an organization, and appreciate you being here to share with us your thoughts on this, and that this really is about the protection of public health, and that's the impetus of what the health director is here, what our Health and Human Services are all about, and I hope that we will all continue to learn and share, and that you'll continue to share your questions tonight and in the future, the time frame before the ordinance is actually voted on September 17th.
As I said in the beginning, chronic diseases really are the single most burden of suffering in our modern day societies. And, you know, I mean, if you look at the health statistics for Mecklenburg County or any similar community, that's what you're seeing. You're seeing not just that people die from heart attacks and cancer, but people die early from heart attacks and cancer and emphysema and diabetes, all of these things being conditions that are very, very closely tied to and caused by use of tobacco products. So that's the reason that we really want to do something about this. And what we'd really like to do as far as the burden of chronic diseases and people who have them is prevent them from having them in the first place. We were thinking about this the other day, and we got to thinking, you know, if there was a vaccine or a pill that could prevent people from getting heart attacks or cancer, people would be lining up for it. I think these kinds of interventions like this ordinance are that kind of vaccine or pill. This will make a huge difference in the number of people who don't develop heart disease, who don't develop cancer, who don't develop emphysema, who don't develop diabetes. These are all things that we would make a difference with this kind of an ordinance. And that's why we're pushing hard for it. That's why, you know, we as the health department feel like it's our responsibility to be a very strong voice for this particular issue. So thank you for your input. We really do appreciate it. We really do hope we can take it into account and make this something that people feel is a good thing for our community.
From a Park and Rec perspective, we have over 210 parks in this community run by the county, 20,000 acres of land, 240 athletic fields, 185 playgrounds, 35 miles of greenways. And in 2010, when we did a big study, there's over 200 million person visits per year to our recreational facilities. And the vast majority of those visits are kids. Like I said, at the playgrounds and all the youth sports, with their parents, festivals, events. There's a reason why tobacco use isn't permitted on CMS property, isn't at CPCC, isn't at hospitals. Those same reasons apply to our county parklands. Thank you.
I wanted to add something. I agree with everything the other panelists have said, but there's something I want to add because it hasn't really been talked about tonight, and that is whenever you enact ordinances like this, educating about cessation or quit support is a real important piece of it, and that is something that we have talked a lot about and would certainly be a big part of the communication. There are resources available, such as the North Carolina Quit Line. In terms of county, city, municipal employees, there are great health plans in place with comprehensive cessation benefits, and that is something in my position that I will be working with others on, and we will do everything we can for cessation or quit messaging, and that either to get through the day smoke-free if you're a county or municipal employee, or just to a lot of times this is what is that final push for someone to quit. health data shows that 69% of North Carolinians have tried to quit, 69% of tobacco users, and so a lot of times this is what supports them in quitting and improving their health. So that's a big piece of it that will be included in our implementation. So.
And I'd like to just thank everyone again for coming tonight. I just have a few closing announcements. If you'd like to continue the conversation that was started here tonight, there is an online public forum. You can visit our website, mecklenburgcountync.gov. There's a button at the bottom that says Meck Connect. You can leave your comments and questions there as well. There's some information over here about that, and I'm happy to help you with it. Just another reminder, the public hearing is set for September 2nd, and I can also help you sign up to speak if you're interested in that.
All right. Again, thank you all for coming, and have a good evening. Thank you.